I talk all the time about being aware of what's in what you eat. And I know a lot of you are reading the label, you're paying attention to ingredients, and I'm so happy to hear that. That's really great. Today, I want to share that we're probably not taking that conversation far enough because there's something else that we put in our mouth that we don't think about reading the label. All of our dental care products and our tissue in there is so soft and so sensitive that anything we're using, toothpaste, mouthwash, any of those things, that stuff is still getting into your system, into your body. So today I have my good friend and colleague, Trina Felber, that is going to chat with us and help educate us about why we really need to pay attention to what is in our personal care products. So first, I'm going to tell you a little bit about her, and then we're going to have a conversation. Trina Felber is the founder and CEO of Primal Life Organics. She's a registered nurse. She has a master's degree in anesthesia. And she is someone who has disrupted the beauty industry and exposed the hyper-toxic personal care products. And, you know, it's really challenging because this is information that's so hard to find. Trina started her natural dental and skincare company in 2008. She puts her nurses' care into every product she makes. She's a multi-million-dollar entrepreneur, the best-selling author of Beauty's Dirty Secret, and she has made the Inc. 5000 list 5 years in a row. She's been featured in Dr. Oz, Paleo Magazine, ABC, CBS, NBC, Fox affiliates, and on hundreds of podcasts worldwide. She is definitely the expert that we want to be talking to. Trina, thank you so much for being here.
Hi, Mira. Thank you so much. I'm so excited to mouth off with you today.
This is going to be great. You know, and I love that you're coming from a mainstream medical background, because chances are what you learned in school did not include that deeper dive into the ingredients that are, in so many of our personal care products.
So many toxins are in the skincare and the personal care products. And the sad thing is, even though, you know, the beauty industry wants you to believe that only a tiny amount is in there, so it doesn't matter, it's not going to hurt you. And I'm here to tell you that if you're using typical women, you know, and I hate to generalize, men aren't as bad as us because they don't put makeup on, but and women use just more products, but women will use about 13 to 15 products a day. That includes like dental, that includes skin, that's hair products, deodorant, moisturizers, body moisturizer, all that stuff is included in there. And in those 13 products, you could potentially have 400 or 500 toxins. Wow. Some of them repeat. So what might be a minute amount in one product that you're putting on, but if you're putting on multiple products that have that same or similar ingredients that do the same type of thing, you could be in toxic overload, and it really is detrimental to your system. Not just digestively, obviously we'll talk a little bit about your mouth and how that affects your whole system. But when you're absorbing things through your tissues of your mouth or through your skin, they go directly into your bloodstream. They don't go, like when you swallow something, you eat something, it doesn't go to your liver to be detoxified. It goes throughout your body full force, which is why even the most minute amount is extremely important.
And, you know, that's such a huge fact that many of us forget. And I talk about this all the time with food ingredients, that whole grass generally recognized as safe, but nobody's keeping track of how much you're getting. And I hadn't thought about the fact that in the personal care field, it's not just how much you're getting because you use it every day. It's every day plus every product. And you're right, that's such an astonishing amount. So let's talk for just a minute. Like, I have some of your products and I love them, especially the dental powder. You know, so many of us are so used to thinking that we have to use a paste, and that of course comes with a whole bunch of added ingredients because they have to do that to make a paste. How did you get into the dental care thing from being a nurse in anesthesiology? practitioner.
Right. Yeah. I went from putting people to sleep to saying, well, I always dealt with their mouth. You have to open their mouth to, intubate and stuff like that. But it happened because my daughter at the age of 2, she had a molar come in that had my husband was brushing her tooth one day and he was like, oh my gosh, what's wrong? That tooth, something looks like it's wrong. Something's wrong with it. So I looked at it. We took her to the dentist and the dentist took one look at the tooth and he said, that's a natural cavity. Happened in utero when she was being developed, that tooth was being developed. I must have had a infection, a bacterial wash, viral wash, high fever, stress. A lot of things can do it. But he said it's not common, but it's not uncommon. And more common is it happens to 2 teeth because both molars or 2 teeth are being developed at the same time. Hers was just one, thankfully, but he said it was a pretty significant defect. So I've got a little prop here. I'll show you guys my tooth. So he said it was a pretty significant defect. What he would do is put a temporary filling in it. And since she's 2, the filling will probably fall out every 2 or 3 months. And every time it falls out, we'll just decide if now's the time to pull the tooth or if we put another temporary filling in it. He said, chances are really good I'm going to have to pull that tooth within a year. So as I was leaving the office, the dental office with her, he says to me, I was upset. He knew I was upset because I know that every tooth is connected to an organ. It's the meridians. It's kind of like the meridian channels. And I knew that if we pulled that tooth, that severed, that tooth organ connection is severed for life. So I was upset. He said, don't worry, Mom. We put a temporary filling in. Now we just hope for the best. And I thought, oh my goodness, there is no way this mom is going to hope for the best. So I'd already been making skincare products. So I started researching. I thought, well, let me see if there's anything I can do. We'd already been using more of a natural toothpaste in it. But what I discovered was that if I continued using what I'm using, that tooth will most likely need to be pulled within a year. I found Dr. Weston A. Price, and I don't know, Mira, if you're familiar with him.
Yes, absolutely. Yeah. Love that whole philosophy. Yes.
Yes. He was a dentist. For anyone that doesn't know him, he was a dentist in the early 1900s. I cannot believe his knowledge is information that we still don't know. Like, we don't know, not because he didn't share it, but because it was hidden. Yeah. The dental community, the ADA tried to hide his findings because they don't want us to have nice teeth. They don't want us to have teeth that doesn't have plaque, and they don't want us to not have gum disease. Sure, they'll tell you that, but ultimately when you look at what they're selling you products that cause gum disease and cause cavities. And I can go into that in a minute. But what I discovered with Dr. Weston A. Price was his research showed that the link between sugar and cavities is so strong that if we get rid of sugar or the bacteria that eat the sugar, if we get rid of that, then we can absolutely prevent cavities. The one thing the ADA does have right on their website, if you look, it says that gum disease and cavities are 100% preventable. 100%. That's not 90, that's not 50. 100% preventable. Then my question was, why does almost every person by the time they're an adult have at least one cavity or suffer from receding gums or gum disease? Then why are children still getting teeth filled? What is wrong with this situation if it's preventable? So what I discovered, Dr. Weston A. Price discovered, in digging through all his research, I've discovered that there are 3 things that your dental products need to have or be in order to create wellness within your mouth so that gum disease and cavities are 100% preventable. The problem with mainstream products is that they are creating more acid in your mouth by 2 different ways. Yeah, 2 different ways. Either one, they are acidic by nature. So you're brushing or gargling with something that is acidic, causing more acid in your mouth. Acid is what wears away at your enamel. Acid from foods or from the bacteria. The bacteria that causes cavities creates an environment, just like cancer, that is acidic by nature. It causes an erosion of your teeth, which basically means that the minerals during an acidic environment, minerals leave your teeth. Acids also wear away at your gums. I don't even think I have to, define that. Everyone can kind of get that.
Yeah.
So those are the problems with mainstream products, is the ingredients are either creating more acid or they are killing all bacteria. You've seen the mouthwashes or the toothpaste that says it gets rid of 99.9% of bacteria. The problem is it's not just getting rid of the bad bacteria, it's destroying your good bacteria. And your good bacteria are that's your little army. They're the ones that are fighting to prevent gum disease, prevent cavities, and keeping you healthy, supporting your immune system right inside your mouth. So when this is what he discovered, and I realized that there's 3 things that your dental products need to be. They need to be alkaline by nature, because if they're alkaline, they can reduce the amount of acid in your mouth, and they can help to prevent any more mineral loss from happening. So alkaline is signified by baking soda. So if you're looking at a product that you're using and wonder if it's alkaline, the best ingredient I can tell you to look for is baking soda. If baking soda is in there, chances are pretty good that it's more alkaline. That's only one thing though. It has to be all 3 in order to work. So the second is minerals, has to have minerals in it. If it doesn't have minerals in it, every mineral that you lose when you're eating red meat, drinking your coffee, drinking your tea, all of these things are acidic by nature. They're acidic. So when you're eating and drinking, you're losing minerals. So if you're brushing your teeth and it doesn't have minerals in it and it's not alkaline, because remember, it has to be alkaline for minerals to go back in. That's when minerals go back in. So minerals have to be present, it has to be alkaline. Then you're not doing anything to put those minerals back in your teeth. So by looking for something, what you're looking for is something that either has clay in it. Bentonite clay is a very common ingredient. I use bentonite, a white kaolin, and French green in mine because the combination has a combination that satisfies all of the mineral content. Your minerals in your teeth are calcium and phos. So those are the primary minerals, but you also have manganese, you also have silica, you also have a bunch of different minerals. And when you lose a manganese, if manganese isn't present in that spot, it's a lock and key. If it's calcium, you're never going to refill that pit. It has to be a manganese. So that's why clay is so beneficial. The other ingredient to look for is hydroxyapatite. I call it the safer alternative to fluoride. Fluoride has no place in your body at all, but hydroxyapatite is calcium and phosphate. It's the exact same minerals that are found in your enamel. So right now, I do use, we added hydroxyapatite to my clay blend with baking soda and then essential oil. So those are the 2 things. The third thing is it has to detox your mouth. Your mouth is filthy. It's dirty. It's exposed to pollutants in the air. It's exposed to heavy metals in water. It's exposed to a lot of stuff in the tissue.
Plus, when we sleep at night, that's when our body, is releasing a whole bunch of things, and it all winds up in our mouth.
It does. It totally does. So using something that has clay will then also satisfy the detox. So it's going to help pull that stuff out of your tissues of your mouth when you're brushing. Most of my customers brush and they spit, but they never rinse, because if you spit and you still have some of that clay or charcoal, I do make a charcoal version too. The charcoal or the clay is going to bind to toxins. And then when you do either swallow or spit, when you either drink and you swallow it, which is fine, because once clay holds onto a toxin, once it's bound, it's an ionic bind, it doesn't release. So you swallow it, it travels all the way through your intestines and you release it. Or you spit it out. So a lot of my customers will just brush, spit, and then go to bed, and it keeps working. And if you swallow some,
if you leave it in your mouth overnight, it's continuing to form a bond and to protect the teeth and gums.
going to just keep, it's just going to look for toxins. It's going to cleanse. And then if you swallow it wherever in your digestive system,
Wow.
I do use food grade clays. So it is okay. You know, I usually suggest people spit. You at least spit out the majority of it, because the majority of it will bind to toxins right away. So you do want to spit it. You don't necessarily want to ingest it, but mine is food grade. That's the problem with most other dental companies that are using clay, is they don't use a food grade, and you will swallow some of it. Your kids will swallow some of it. They've done studies. You do swallow your toothpaste, even if you think you don't. So it really should be food grade. So my clays are all food grade. All of my ingredients are food grade.
That's amazing. And, you know, so one of the other questions that I have then is, you were talking about the fact that unfortunately, so many of these products that are recommended to us by the mainstream dental community are stripping the bacteria from our teeth. And I know, like with the gut, when we have issues going on and we take antibiotics, or if we've had some sort of a stomach upset, we recolonize the gut with lacto-fermented foods and probiotics if needed, and that kind of thing. How do we recolonize the mouth?
The mouth is actually pretty easy. It's actually fairly easy. I'm actually coming out with a toothpaste that has a little bit of a probiotic in it.
Oh, wow.
But the mouth is actually fairly easy, because you're exposing your mouth to a lot of stuff. And the bacteria tends to regenerate pretty quickly. I usually say it takes about 3 days after you brush. So if you're using mouthwash, which for me is a big no-no, anything with alcohol, anything that has triclosan or SLS. But if you swish with mouthwash, here's the biggest problem with mouthwash. Isn't that you're wiping everything out immediately. The problem is the long-term ramifications. If you use mouthwash twice a day, then it takes like 3 days to start to rebuild that microbiome, that good bacteria inside your mouth. So if you're washing and brushing twice a day with something that's stripping everything, it's like taking an antibiotic twice a day for life. And we know what antibiotics do to our gut. This is what our dental products are doing to our mouth, which is the start of your gut. You do need good bacteria. It's different bacteria than in your gut for a lot of reasons. It's the environment. It's exposed to so much. You do swallow everything in your mouth. That's really gross. People still go, oh, I didn't even think about that. Everything in your mouth goes down the chute. Unless you spit it, everything goes down the pipe. So what we have to stop and think is, what's in our mouth? If it's bad bacteria and we're swallowing that, we are feeding and seeding our gut with the wrong bacteria. Most people will never completely heal a digestive issue until they start with the start of their intestine, which is inside their mouth. When you feed and seed your gut with good bacteria, that's when the ball game changes. But the problem with starting with your gut is that you miss the first about 12 to 13 inches of your digestive system. And we really need to change the microbiome so that when you do swallow something, it's good bacteria. This is why babies that are born vaginally have a stronger immune system than babies that are C-section. Because when they go through the birth canal, they get exposed to good bacteria in mom. Yeah. That bacteria is in their nose and their mouth. Their first swallow, they swallow that bacteria seeds and feeds and builds their gut bacteria. But when we wipe it out, when it's not present in babies that are cesarean section, if it's not present, their immune system isn't as strong, and that's why. And when we wipe it out continuously with the products that we're using, we're just destroying the first part of our gut, which then carries all the way through.
So what are some of the things that we need to do aside from making sure that we're using like good clays and other healthy products that we can do to detox and sort of reverse or overcome all the damage that's been done to our oral microbiome?
That's a good question. And I always get the question too about whitening my teeth. So this kind of goes in the same way. Like, well, let me talk really quick about when you're eating a lot of acidic foods, the bacteria is creating more acid. It's eating away at your enamel. What happens over time is that your enamel becomes thin. You're losing more minerals than you're putting in, and your enamel starts to get thin. What tends to happen is that we start to see our dentin, which is the layer beneath your enamel. You start to see that reflected through thin enamel. When your enamel becomes so thin that it becomes almost like a glass, you start to see yellowish, grayish, or a bluish tinge to your teeth. And that's because that's the color of your dentin. Dentin is either yellowish, bluish, or grayish. So when it becomes super thin out here, you've got a weak enamel, you're going to start to get fractures, you're going to start to get more cavities, and then you're exposing your dentin is going to become more apparent to you. Peroxide, let me talk about how peroxide works, because peroxide is the #1 selling agent to whiten your teeth. Peroxide works. So your dentin is fluid filled. It's fluid filled because it's like your shock absorber. When you bite, your hard enamel needs something in the cushion to prevent you from feeling it, because inside your dentin is your pulp, which has your nerves and your blood vessels. Your dentin has proteins in it that are antimicrobial, antiviral, antibacterial, so that if anything seeps in there, it can attack it and kill it. And it also has minerals in it. It has some minerals. So it's kind of a squishy. It's not completely fluid. It's kind of squishy. What happens with peroxide is because the coloring of your dentin, the way to make it look more opaque is to pull the moisture out, pull the fluid out.
Wow.
So peroxide, I say peroxide dehydrates your dentin. It pulls out the fluid.
Wow.
What you've now done is weakened the infrastructure of your tooth. You've now at an increased risk for fractures of your tooth, cavities of your tooth, and then damage to the internal structures. So that's how peroxide works. So when I discovered this, I thought I've got to figure out a better way, because brushing helps with the right products, using, getting rid of mouthwash, and using something that's an oil-based. I make an oil-based gum serum that goes on your finger, 1 or 2 drops on your finger, and you rub it right on your gum tissue, made with olive oil and essential oils. That is going to help increase blood flow, reduce inflammation, and then allow the good bacteria to help you repair your gum tissue. The other significant way to do this is something that I've developed that's kind of unique. So this is a mouthpiece, goes right in your mouth, and it has blue light, red light, and then a combination. So these are LED lights. They are safe inside your mouth. They do light up your gum. They're for your gums and your teeth. And I'll go through what both of them do. The blue light is, Harvard did a study, and they studied the bacteria inside the mouth. And they found that the bad bacteria has this red part of it. So it's kind of like a heme or a little molecule that's red. And blue light, when exposed to blue light, the red part explodes. It causes this explosion, which basically kills the bacteria. So blue light set at the right wavelength will destroy the bacteria that has that heme, which is the bad stuff you don't want. So putting this in your mouth, the nice thing about light is that it penetrates. It's not just the surface of your gums or your teeth or whatever. It can actually penetrate tissue. Just depends on the condition of your teeth or your gums on how deep it will go. But imagine the light penetrating between your teeth or penetrating into the pockets of your gums where bacteria like to hide. And what that can do to the bacteria, it can pretty much annihilate it. So the blue light's really a great benefit for your gums and your teeth. Red light does the same thing for your gums that it does for your skin. Red light therapy has been used for years to increase blood flow, reduce inflammation, and increase collagen production, all of which is extremely important when we talk about regenerating gum tissue. Collagen is extremely important. Blood flow is extremely important, and reducing inflammation is really important. So this is a therapy that's going to help with the gum tissue. A lot of people, what I tell people is if you really have a bacterial issue, do blue light. If you have more of a gum issue, receding gums, or, want to help heal your gums, the red light. If you have healthy gums and healthy bacteria, you can do the combination. But treatment is about 15 minutes inside your mouth, 1 time a week or 1 time a day for a week. It's 4 weeks. So 5 days a week for 4 weeks. So 20 treatments for a month. And then after that, it's about 2 treatments a week for life. And the gel that comes with it that I made is a nourishing gel that's going to help remineralize your teeth. Remember, the best way to whiten your teeth is to rebuild the rock hard enamel. The
So-
thicker your enamel.
I have a question then. So what, if I'm hearing this correctly, even after doing all this damage because of dental products that are very acidic and removing minerals, and possibly, like, I know some people like to swish with hydrogen peroxide in their mouth. Like that's a big thing that you read about on a regular basis. So they're doing all this damage to their teeth. And then if they switch to using those kinds of products, can they actually rebuild their teeth?
Oh, absolutely.
Wow.
I've had people, I have healed, had people that had needed cavities filled, or I had one woman, more than one, but one woman called me when they left them out. This was years ago, before I had a customer service team. This was me answering everything, but she called and she left a message saying that she had 6 cavities and needed 1 root canal. And she bought my Dirty Mouth tooth powder. This was just the tooth powder. This wasn't even the teeth whitening that will help even more now, but she bought the tooth powder, and it was a last resort. She didn't want any of her other teeth going bad, but she went back about 2 months later to get the root canal done. And the dentist, she sat down in the chair and the dentist said, "Miss Gibbs, you can go home. You only have 1 cavity and it doesn't need a root canal. So go home." So like all of her teeth got better. Yes, you can definitely rebuild your enamel. You can regenerate gums. I just had someone post a comment yesterday on Instagram. I talked about gum recession, and she said, I was talking about the red light, and I was talking about the gum serum that I make. And she said, I can 100% attest to this. I had receding gums that were so bad. I tried everything that I could. She said, in a matter of time, I started using the red light and the gum serum, and my gums are 75% back. I think it's only been like 4 weeks. She said, so yeah, so it definitely can happen. The thing is, you have to stop the reason that these either cavities, mineral leaching, or gum recession is happening. And it's usually related to the acids and the bacteria. Sugar plays a part in both of those. So sugar could be a catalyst. So limiting the sugar in your diet is very important, or at least brushing afterwards or swishing your mouth will never 100% eliminate sugar or like acidy foods. But the main thing is if you can stop what you're brushing with and start using things that are friendly to your mouth, then you're going to have a better chance of rebuilding your enamel and regenerating gum tissue. Totally important.
Yeah, because I know, so many people have issues with their gums where, like, especially in the spring with allergy season and all the pollens and the histamines and everything, their gums get very puffy and very swollen. And so then they start using all sorts of dental products to try and calm that. And it sounds like what they're actually doing is stripping the bacteria and basically not helping their teeth. Whereas if they use something like that, that might help. Is that?
Oh, totally. It could totally. Yeah.
That's
totally.
amazing.
It's going to at least stop the process. And then as long as you're, consistent, consistency is the key, like with this, and especially with the dental stuff. I'm not asking you to do anything new. I'm not asking you to, add anything to your program. Just change what you're using. Give it 30 days. I have a dental detox kit. I'll get the links for you for both of these.
Sure. No, that'd be great. Well, I love your tooth powder. I have to say, first of all, it's great. I love it. The other thing is it's powder. Hello. You do not have to worry about how big it is or is not to get it through when you're traveling, because it's just a powder. And so it's highly portable, but it's good. It doesn't, when the first time I ever tried a charcoal-based tooth powder, I was like, charcoal, really? And I thought it was going to taste terrible, and it doesn't.
No, it tastes good. Yeah. And just so everybody knows, to make sure that you click through the links that Mira gives you, because you guys are going to get a special price. For the LED, if you're interested in this, it will be 60% off what we sell it on the website for. Our regular price on the website. So yeah, just make sure that everyone clicks through your links. I want to make sure they click through your links, because that's where the special pricing, and then the detox kit as well. And if you're looking to purchase the whitener, you will get an opportunity to purchase the dental detox kit as well. But I want to tell everybody, the gel is peroxide free that goes with this, so it won't hurt your mouth, it won't hurt your teeth, like you won't get that zing sensation like peroxide causes. It's an olive oil base. It has essential oils in it that is going to help whiten and help with your good bacteria, help cleanse the tissues of your mouth, has 2 clays. So while it's sitting on your teeth for, 15-minute treatment, the minerals can then have a better chance of remineralizing, rebuilding your enamel. It has hydroxyapatite, which is the main foundation mineral of your teeth. And then it also has a gentle cleanser, a gentle cleansing agent that's not bleach, that's going to help remove the surface stains along with the clay. And there's a little bit of white activated charcoal in here. So it's loaded, but it's
That sounds
really
like
good.
a powerful, powerful little tool.
And it actually tastes really good. It has a really unique taste, but it does have a really fresh, it leaves your mouth feeling so fresh and your teeth feel so strong when you're done using the treatment. So I do recommend anyone, this is for anyone, even if you don't feel like your teeth are impaired or your gums are receding yet, because the sooner you use the light therapy and gentle products, the less likely you will have problems, because they sneak up on us, like everything. You were one day 22 and then you wake up, you're like, oh my God, I'm 45. Wait, how did that happen? Right? So does gum disease and cavity. Like they all sneak up on us. What? You mean I have a cavity? It's deep? I didn't know that. So this is going to help prevent, no matter where you are in your stage of life.
Well, and I love how your first recommendation is to really get rid of the products that are causing an issue. Because for me, my big thing is I encourage people, read the label, the 3 most powerful words, and that applies to your dental care products as well. And so to really be able to make that shift and then add in some beneficial therapies on top of it to support the body and the mouth. Because like you said, my practice is focused on gut health and chemical cleanup. And you're right. You're like, so many people don't realize that your mouth is the start of digestion. It's the start of your gut. It's the beginning to that whole wellness, base, because the gut is the base of total body wellness. But it starts up here. And totally so when we begin to make those changes, that's where we have a long-term powerful impact. And so I just love what you're doing. And thank you so much for that generous offer. Oh my gosh, that's amazing.
Well, and I just want to let everybody know, the question I always got was, where do I start? What do I start with? So I put together, it's called the Dental Detox Kit, and it truly does all 3 things that I talked about. My entire dental line was built off of the research of Dr. Weston A. Price. And it does come with, it's a 60-day supply. So this is one person, this is your kit for 60 days. Don't use anything else. Like at least give me 30 days. Okay. Like don't, anything else you put in your mouth. And if you think that your toothpaste is natural and safe and okay, my biggest warning is like, read the label. One of the worst ingredients that's 100% safe if you swallow it, 100% safe for you, but detrimental to your teeth, is glycerin. Glycerin in toothpaste is detrimental to your teeth because it puts a Band-Aid coating on your tooth and prevents minerals from getting back in. So it doesn't matter if the product has, if it has baking soda and it has minerals in it, but it has glycerin in it as well, it's not going to do you a bit of good. It's not, glycerin is going to put this Band-Aid coating. So what happens, and this is just a testament to how you were really on the wrong path, but didn't know it. When people start using my tooth powder, it will brush off that glycerin coating or sensitive teeth coating, whatever they put in there to cover, like they put that Band-Aid on. So you might have an increase in sensitivity for a day or 2. I usually tell people if that happens, that just means you really, really, really needed this. So what I tell them to do is brush 3 to 4 times a day with the tooth powder. The more that you can brush with it, the faster those minerals are going to go back in. And usually people tell me within 2 to 3 days, the sensitivity is completely gone and better than it ever was. So it doesn't take long. It really doesn't take long to fill in a lot of those holes that are actually deep enough causing pits in your teeth. I always like to show people this. This is actually, I used to have these rocks in my front yard. It's just lava rocks, but I loved it because one day I looked at it and I'm like, oh my gosh, this is like the surface of the moon, but it's also like the surface of your teeth. Wow. Because we don't see the little pits in our teeth at all. Like you can see those little pits.
Yeah.
And what I tell people is those pits aren't going to get any better. And glycerin puts a Band-Aid. Like if you think about saran wrap over that, nothing's getting in there. But if you brush with my Dirty Mouth tooth powder, oh, I thought I had one that was open. You can kind of see how it's on here, how it's white. The tooth powder actually clings to those pits, and the minerals will help to fill in. So over time, those pits can get smaller and smaller and smaller and smaller. So that's what you get. You get a morning and a nighttime. The nighttime has charcoal added, has the same ingredients with charcoal added. So most charcoal toothpaste or powders are straight charcoal or charcoal and 1 clay, but mine is charcoal, 3 clays, baking soda, hydroxyapatite, and a little bit of essential oil. Peppermint is what these are.
Yeah.
You'll get a biodegradable toothbrush. It's made from bamboo, will biodegrade. Here, Mira, this is crazy. Plastic, it takes 400 years for plastic to biodegrade. This toothbrush will take 5 months, 6 months. So that's important. And then biodegradable floss picks. These are made with cornstarch, so they will biodegrade. Bamboo is the string. And then you get a copper tongue scraper, which you won't have to toss. It will last you for life if you take care of it. You get my gum serum, so there's no mouthwash needed. And then because most people, when they're switching to natural, their biggest pain point is they can't find a deodorant that works. So I throw in my deodorant.
You throw in your deodorant, which I love. I love your deodorant. That's so funny.
So you can, yeah. So you get the whole kit for your mouth, but you also get, it's about a 30 to 60 day, just depending on how often you use your deodorant, but a 30 to 60 day supply. This is your kit. This is your dental detox kit.
Well, and I love how you've been able to share with us stuff that we don't learn. Like nobody talks to us about how all of these acids are actually stripping minerals, stripping bacteria, and then preventing our body from reforming the way that it wants to because it can't rebuild. So I love that you've shared that. That's really, really powerful information. Thank you so much.
Thank you.
So Trina, if someone wanted to connect with you, aside from following the link to get your fabulous products, where would they find you?
Well, the website is primallifeorganics.com, but we are on social media. Primal Life Organics on Facebook or Primal Life Org on Instagram. We're on Pinterest, we're on Twitter. You can locate us there. I have a customer support team, support@primallifeorganics.com. If you have any questions, reach out to us. We're here. I'm here for you. I'm a nurse. I love educating people. My primary goal is to educate you on what to look for, what to avoid, how to heal your body. Whether you choose to trust my products or not, that's totally up to you. But I at least want you to have the knowledge to know where you are and what you're using and whether it's working or not working. Here's one thing I like to tell people. If what you're doing today and you're not seeing changes, if you're not getting better and things are getting worse, you go to the dentist, they're scraping plaque off, you have a cavity, your gums are getting worse. If you continue doing what you're doing, nothing's going to change. Nothing will change. You will continue to get worse and worse and worse. But if you do make a change, there's a possibility, the possibility is endless, that change can happen and things can get better. So I just invite people to make a change, a simple change of what you're using and see what happens.
That sounds great. Well, Trina, thank you so much for being here. This has been really interesting talking with you. And folks, I'm going to put the links down below. Be sure to click through, take advantage of her very generous offer. And also make sure that you click like, subscribe, so that you will be in the know when we have more fabulous guests. In the meantime, take care, be healthy, be well. And Trina, thank you.
Thank you so much.
Bye, folks.